Do either of your parents have bipolar disorder? Do you think you might have it? Bipolar disorder is a serious mental illness defined by severe erratic mood swings. Anyone can develop this condition, but it is most common among people between the ages of 18 and 35. The heritability of bipolar disorder is 79 to 93%, meaning people whose parents have the illness are more likely to inherit it. There are now genetic tests you can take that will determine if your genes have any of the traits or mutations that could cause this condition. Genetic tests can help to identify gene changes that may increase the risk of developing a disease, determine the severity of a disease, guide doctors in deciding on the best medicine or treatment to use for certain individuals, and screen newborn babies for certain treatable conditions.
You can easily be tested in your doctor's office by taking a swab on the inside of your cheek, which is completely painless. The DNA from this swab is then placed into a microscopic spots on a microarray known as a SNP chip. This test will amplify SNP variation within the microarray and will show the mutation in the genes. The results usually take 3 to 5 days to process through an algorithm. If bipolar disorder runs in your family, you might want to get tested to find out if you inherited this mutation. You might also want to be tested if you already have or are planning to have children and are worried about passing down a faulty gene. If your SNP chip test comes back positive for a gene variation, it's possible that the mutated SNP is RS2953145.
This SNP has three different versions: G and G, C and G, and C and C. The risk allele for RS2953145 is G and is autosomal dominant. When homozygous, G and G increases the likelihood of developing bipolar disorder by 2.1 times. C and G, a heterozygous genotype, would increase the chances of getting bipolar disorder by 1.8 times. Some reasons you might consider not having the test include the anxiety that could come from testing positive without a guarantee of developing the disorder. If you test positive for the trait variation but don't actually have the disorder, you could be prescribed costly medication with the side effects you don't really need, and the test itself could be expensive. If you're interested in getting tested, talk to your doctor to see if a SNP chip test is right for you.